The goal of this study is to improve the treatment of severe traumatic brain injury among those patients who do not receive intracranial pressure monitoring. It's an observational study, and it's run in two sections. The first section has centers which used a protocol that was developed for a prior study, and those continue to use that protocol. The other centers have never used a protocol, and they just treat patients individually, however the clinician on service at that point wants. Then there's going to be a consensus conference where hopefully improved protocol is developed, and then all the centers will use that improved protocol to see if indeed outcome is improved with it. Although the Brain Trauma Foundation would suggest that all severe traumatic brain injury should be treated based on measurements of intracranial pressure, globally about 90% of the cases do not have intracranial pressure monitored. People are treated based on clinical examination and on imaging. And this study is trying to improve the treatment of those 90% plus of patients in the world. They're the experts. They're the ones who are treating patients without the benefit of the numbers from monitoring. If you talk to the leaders of the traumatic brain injury field in the United States and Western Europe, none of them have treated a patient without ICP monitoring. They wouldn't know what to do. So these are the experts in the field. These are the people with experience. And so these are the people who need to be engaged in order to develop and evaluate treatments to be used without the gadgets that the folks in high-income countries are used to. There's two ways. One would be in order to do comparative effectiveness research. It'll be great to have a broad range of studies and patients that are treated in different ways. The other way is more speculative. I expect there's people with questions we haven't even thought of that might find collaborating and using the data that's been collected in this study to answer new and different questions. Since 90% of them are treated this way, without ICP monitoring, I think it has a great chance to benefit. When we started our prior study, which was a randomized trial comparing treatment based on intracranial pressure monitoring versus that based on imaging and clinical exam, we checked the literature for a protocol for imaging and clinical exam. There was nothing. Well, now we've published our experience, our protocol, but honestly, that protocol was based on the experience of 3 Bolivian clinicians sitting around drinking beer one afternoon. We think that engaging a broader group of clinicians and using a more detailed process to get their experience collected and vetted should lead to a better protocol, which we would then publish and hopefully would be used to improve the treatment of the 90% of the people in the world whose severe TBI are treated without the benefit of intracranial pressure monitoring.